major change coming for women's health testing.
Yeah, the U.S. Preventative Services Task Force now recommends women start getting breast exams at age 40 instead of 50.
Yeah, it's estimated the change could save the lives of 19% more women.
Dr. Christopher McGreevy is a breast cancer surgeon at Hackensack University Medical Center, and he joins us now to talk all about this.
Good morning.
Good morning, and thank you for having me to discuss this very important topic.
Very important indeed, Doctor, right? Because there's a bit of a back and forth here. First it was 40, then went back up, now it's back down. So what's your take on the age change proposal from the U.S. Preventative Services Task Force about this very issue?
So I think this is a definite move in the right direction. The United States Preventative Services Task Force recently, as of yesterday, recommended screening mammograms in women starting at age 40. This is not new information. The American Society of Breast Surgeons, the American College of Radiology, and the Society of Breast Imaging have been recommending screening mammograms at 40 for women for several years. At Hackensack Meridian Health and Hackensack University Medical Center, we have been performing screening mammograms and recommending screening mammograms on women at age 40 because of these recommendations.
So why the switch back?
So they looked at newer data, which now showed that there's about 20% of women that are diagnosed with breast cancer between the ages of 40 and 49.
Okay.
The issue previously, why they said 50, was there was concern about false positives or overdiagnosis. Our new mammographic images are much better than they used to be, and I think that's what's represented now in the new screening recommendations.
Yeah, because this kind of was an eye-opener yesterday, and then so many women were saying, well, we've been doing it since 40 anyway. In your experience, though, have women adhered to, I guess, the 50 age rule, and do you think they'll actually start coming in earlier now?
I think so. Women were adherent to the 50 age rule. I think what the United States Preventative Task Force recommendation does is it really gets the message out to primary care physicians and OBGYNs, because they are generally the physicians that are recommending screening for patients. The American Society of Breast Surgeons is an organization that speaks mostly to breast surgeons, but the USPSTF message is now reaching more physicians, so hopefully we can get more patients screened earlier.
What about frequency, though? Because right now, doctors recommend every 2 years. Will it go back to every year?
So the American Society of Breast Surgeons, American College of Radiology, and the Society of Breast Imaging have always been recommending annual screening mammograms starting at age 40.
Okay.
The United States Preventative Services Task Force doesn't agree with this, and they are recommending every other year. So there's a little controversy over when to screen or how often. But the doctors, physicians that deal with breast cancer, we recommend screening annually.
Okay. Yeah, and then there comes the race factor as well, right? You know, the median age for diagnosis is 62 for breast cancer, but it could vary by racial group. So briefly here, trying to talk about that and the disparities.
Yeah, so Black and African American women have been known in the literature for years now to have higher mortality rates or higher death rates from breast cancer, whether this is from an access to screening mammograms or an access to available health services has been looked into, and it's definitely part of the problem. But we also know that when controlled for these factors, Black and African American women still have a slightly higher risk of death from developing breast cancer.
Well, Dr. McGreevy,
there are some.
Oh, go ahead.
There are some that believe that African American women should start screening earlier, and possibly as early as 35.
Oh, wow.
What we recommend is that women at 25 years of age have a risk assessment done by their primary care doctor or OBGYN, looking at things such as family history to develop a plan of when they should be screened.
Wow, great advice. Dr. McGreevy, thanks again for joining us today. We really appreciate your time.